The rate of new daily COVID-19 infections within the province of Ontario is rising, which medical professionals say is to be expected. But even so, they are pausing the loosening of further restrictions out of an abundance of caution. On November 10th, Ontario's top doctor, Kieran Moore, announced capacity limits would not change in the remaining settings where proof of vaccination is required. That includes food or drink establishments with dance facilities such as nightclubs and wedding receptions, or at strip clubs and bathhouses.
And because Ontario is seeing an increase in some of its key indicators, including the effective reproductive number, the percent of tests that are positive, and our weekly case rates, and out of an abundance of caution, we are pausing the next step of the plan to reopen Ontario and manage COVID-19 for the long term. This means that the planned lifting of capacity limits in remaining settings where proof of vaccination is required will not be moving ahead on November 15th.
Ontario's rolling 7-day average of COVID-19 cases now stands at 502, up from 379 at this time last week. On Thursday, Ottawa reported 39 new COVID-19 infections within the city, a number which seems to be staying steady. Dr. Moore says transmission is mainly among young children who aren't yet eligible to be vaccinated and those who are eligible but decided not to get the shot. Ontario currently has a vaccination rate of 88.5% for one shot of a COVID vaccine and over 85% for 2 shots. He says as we enter the winter months, we all need to ensure we take precautions to keep everyone safe.
As far back as July, I spoke about an anticipated rise in cases as we move towards the fall and winter. We are now seeing this occur in some parts of Ontario. As the temperature begins to drop and more people move indoors, we can expect to see cases fluctuate or continue to increase over the coming months. While this is not cause for alarm, it will require continued vigilance from each of us, and we must stay cautious and disciplined in the face of this virus. Provided we follow public health measures and increase our vaccination rates, we can continue to manage transmission of the virus at a local level and minimize the impact on our hospitals and intensive care units.
Just a few weeks ago, the province released a roadmap for when all COVID-19 restrictions could be loosened. That includes potentially removing mandatory proof of vaccination in settings such as gyms and restaurants by January, and the removal of mask mandates by the spring. The announcement came with much controversy from those who said it's still too hard to predict what could transpire over the next few months, especially as young children still aren't eligible for COVID vaccines. Approval is expected in the coming weeks, but even then it will take months to get jabs into arms. Dr. Moore says data is being reviewed every 28 days and reassures parents that the government's priority is to keep kids in school, saying closures almost certainly won't be coming.
Given the rise in case counts in the province, that we are making a data-driven decision-making process. And so at January 15th, that week, it was our goal to reassess the data and make a decision at that time about continuing verification in certain environments. So I will assure all Ontarians we will continue to advise the government using best data and analysis of the risk for Ontarians at the time, that the plan will continue to be on the second week of January to reassess the data, so that will reflect the holiday season, the return to school, colleges and universities, and at that time make any further determination on further removal of public health measures.
Now, in the past, the Government of Ontario has said that they would reduce capacity limits and crowd sizes if cases continue to rise, but said they would do it on a regional basis. But today, Dr. Moore says that is unlikely, and all they're planning on doing for now is pausing further reopening plans. He says he doesn't expect we'll take any steps backwards, but of course, as we know with this pandemic, things can really change on a day-by-day basis. Charlie Sant, UAN News, Ottawa.